In a Foothold Awards versus Behave Health comparison, picking the wrong behavioral health EHR can mean months of work to undo. Getting the platform wrong means months of migration, staff retraining, and potential revenue disruption. Both platforms land on the shortlist, but they are built for very different organizations. Let us compare them where it counts. We will compare the two across admissions, clinical documentation, billing, and operational capabilities for your organization. A platform built for public-funded human services and one built for private pay addiction treatment solve very different problems. Foothold Awards by Foothold Technology appears designed for behavioral health and human services, shelters, housing, and developmental disability programs. It appears to support HMIS and HUD Continuum of Care data standards, a core requirement for housing-focused human services organizations. Behave Health serves the addiction treatment continuum, residential, detox, IOP, PHP, and recovery residences, with a focus on private pay and commercial insurance. Choosing an EHR is one of the most consequential decisions an operator makes. It touches every part of daily operations. The platform you select touches everything from the first inquiry call through clinical documentation, billing, and outcomes tracking. A tool built for HUD grant reporting and Medicaid human services fits a very different workflow than private pay addiction treatment. Behave Health combines CRM, EHR, RCM, and ERP into a single system purpose-built for private pay addiction treatment. Instead of stitching tools together, admissions, clinical care, billing, and operations live in one platform built for the work. It is designed to support the addiction treatment continuum and recovery housing. Purpose-built, not adapted from human services. Let us walk the 4 areas where the platforms diverge most: admissions, clinical, billing, and operations. Here is how Behave Health is designed for the private pay treatment workflow across all 4. First, admissions. In private pay behavioral health, delays can mean a prospective patient never enters treatment. Behave Health is designed to support instant verification of benefits, confirming insurance coverage in real time during the inquiry call. Online patient applications, lead and referral tracking, real-time census across locations, and alumni tracking after discharge. A record created during the admissions inquiry flows directly into clinical documentation and billing without duplicate data entry. Second, the clinical record. Behave Health is built for facility-based addiction treatment workflows. ASAM criteria assessments for level of care placement, plus COWS and CWA scoring designed to support safe withdrawal management. Group therapy notes with attendance tracking, and treatment plans with templates for residential, PHP, IOP, and outpatient settings. Outcomes tracking uses validated instruments like PHQ-9, GAD-7, and the CSSRS, plus NAATP Force. Third, the revenue cycle. Clean claims and effective denial management separate sustainable operations from cash flow problems. Eligibility verification, electronic claims submission and tracking, and ERA and EOB processing for payment reconciliation. Denial management with tracking, appeal documentation, and follow-up workflows built into the same system. The RCM is designed for the utilization review, per diem, and medical necessity workflows of private pay addiction treatment. Fourth, and the biggest difference, what happens outside the clinical record and billing system. Behave Health includes an ERP layer for property management, vehicle and transport coordination, staff credentialing, and maintenance scheduling. A comprehensive ERP designed around treatment center operations does not appear to be part of Foothold Awards, based on publicly available information. When everything shares one patient record, clinical, billing, and operational data stay connected instead of scattered across systems. Without one platform, teams piece together spreadsheets, separate property software, and manual processes to fill the gaps. Behave Health is designed to consolidate operational management alongside clinical and financial workflows in a single place. If you are a current Foothold or Awards user weighing a change, Behave Health provides a structured migration path. The team manages your data migration, so your records move without starting over from scratch. Staff training is part of the transition, so your people are ready on day one. Parallel go-live support is designed so the switch does not disrupt your operations or revenue cycle. Stop risking months of migration on the wrong fit. See how the all-in-one platform compares on your real workflows at behavehealth.com. Walk through CRM, EHR, RCM, and ERP in one platform. Book a demo at behavehealth.com.